Hi everybody, it's Adam again, the geneticist from Verdure Healthcare. Today I'm going to talk to you about chromosome 4, the fourth largest chromosome in our human body. So, as you can see here, and also you should be able to recall, there are 23 chromosomes in our human body. So in the previous weeks we have spoken about chromosome 1, 2 and 3, and now we are now turning to chromosome 4. Okay, so chromosome 4 actually takes up about 6.5% of our total DNA. Now, as you might understand by now, the relationship between chromosome and DNA, so actually DNA are packed into chromosome just like how strings are packed into balls of strings. Okay, so and if you haven't grasped the basics quite clearly, I would strongly suggest you to go back and watch my first introductory video, part 1 and part 2. They are included in this series. Right, so this is it. This is chromosome 4 on its own. So as you can see, it is not that long compared to the previous ones we talked about. And these are the locations that have been marked, and they are all essential to our human function. So there are a total of over 186 million pieces of DNA in chromosome 4. So there are quite a few diseases that I want to put my emphasis on. So mainly the conditions that are associated with chromosome 4 include neurological and neurodegenerative disorders, the connective tissue disorders, and also dwarfism, meaning the stature is quite short. So, just to remind you, there are two main kinds of genetic diseases. One would be single gene disorder, and the other one would be the entire chromosomal abnormality. So single gene disorder, meaning to say that there are only some bits and pieces missing or being inserted wrongly or being substituted wrongly by other genes, and these are on a very small scale. But chromosomal abnormalities, for example, if you have an extra piece of chromosome, then that belongs to this category. So, this is one of the diseases I want to put emphasis on because it is a very serious one, Huntington's disease. So Huntington's disease is caused by or generated from a gene called HTT. Now HTT gene, you don't have to remember all these details, I just want you to know about it. So this is what the HTT gene or protein actually looks like. It might not have any meaning to you, but to scientists, what we are looking for is that, okay, so this is chromosome, and then we focus on to the gene, and we'll be able to see that actually there are more stuff being inserted. So they shouldn't be there, but they are there, and that's how it causes Huntington's disease. So mainly, this is a brain disorder, and it actually controls movements, emotional problems, and even thinking capability. And thinking capability, there is a name for it, it's called cognition, okay? Right, so as you can see, this is the normal brain, and with Huntington's disease brain, it actually shrinks, okay? So as time goes by, this individual's brain will actually shrink. So normally it actually appears in someone's early 30s to 40s, so that's how this disease comes about. And then, okay, so what are the main symptoms? The main symptoms, okay, meaning to say that the cognitive thinking capability is very low, or it will get progressively lower. The mood swings, and sometimes even involuntary movements. Okay, it's a little bit different from Parkinson's disease, which we will talk about later. Involuntary movement, for example, if you're standing there, if you get Huntington's disease, sometimes you might just move your hand like that without even being noticed, without yourself noticing it. Okay, you might experience speech difficulties, so that's one of the symptoms. And then behavioral changes, so this is a little bit different from mood swings because behavioral change Meaning to say that, okay, if let's say you are a very patient person, but suddenly you become very aggressive or impulsive. So that's a total behavioral change. Right. And also hallucinations. Hallucinations is a bit of, you can, it's not illusion though, but it's just very unclear thinking, yeah? Something like that. Or even you're seeing some shadows or pictures that's not even there. That's hallucination, just to put it in more layman terms. Okay, so when this particular person has the symptoms of Huntington's disease, usually the situations would get worse quite quickly, and therefore this person can live about 15 to 20 years after the symptoms had came out initially. Right, let's move on to Parkinson's disease. Parkinson's disease, I'm sure majority of you have heard of it, and it's not that uncommon in Malaysia. So basically, what is Parkinson's disease? Okay, it's a neurological movement disorder, so it's a movement disorder. So just now compared to Huntington's disease, it's a holistic neurological disorder, but this one is just a movement. It includes rigidity, so for example, the back feels very hard, something like that. Posture instability, meaning to say you can't stand in a posture for a long time. Tremor, I'm sure you've noticed that's quite the most common symptoms of Parkinson's disease. And yeah, walking difficulties as well. And then, so this is pretty much the symptoms of it, and then it can be improved or even be resolved by medication. Right, now this is a difficult one. Let's see if I can pronounce this correctly on the first go. Facial scapulohumeral muscular dystrophy. Okay, take a challenge, try to pronounce this. So anyway, this is also one of the disease caused by chromosome 4. And as you might be able to guess, once again, this is a muscular atrophy disorder. Okay, so usually it will affect the muscle groups in the shoulder, okay, in the face, in the arms, and then sometimes even the eyes might be affected. So basically, these are some of the symptoms that might be exhibited for somebody with this particular muscular dystrophy. Right, now this is a special one, and this is quite a scary disease as well. As you can see, there isn't a Chinese translation to it. It's quite difficult. So the Wolfhershhorn syndrome. Okay, Wolfhershhorn syndrome is actually characterized by halted growth. So what's halted growth? Okay, it sounds scary, bear with me. This particular person will stop growing at around toddler stage. Okay, let me get that clearer. Okay, you know what does a 4 or 5 year old child looks like, right? Okay, their height is pretty much just like this, and anybody with Wolfhershhorn syndrome will stop growing at that particular stage. Yes. And then, of course, it will affect intellectual capabilities as well, meaning to say they have intellectual disability. Facial abnormalities, as you can see, of course this is a drawn picture, but anyway, when people get this particular disease, they will also get, like, for example, cracked lips, or cleft lips, and cleft palate as well, and then sometimes even seizure. So this is quite a horrible disease that we have to prevent, and there is no cure to it. Right, achondroplasia. Okay, so this is dwarfism, rather dwarfism-like kind of symptom. So it means that this particular person will get very short toes, very short fingers, but pretty much the head would be bigger as well compared to the body size. And and then the elbow movement might be quite limited. But the thing is that they won't get intellectual disability. So it belongs to the category of muscular atrophy rather than neurological disorders. Right, and the thing is that, okay, there's one thing I want you to be aware of regarding this particular disease is that people with this kind of problem, usually their backbone will be twisted. Okay, put it in layman terms, will be twisted and sometimes even compress the spinal cord and cause the brain to have a built-up of fluid in there. Okay. Right, now this is scary. This is blood cancer. Now, for some people who don't know, there are many kinds of blood cancer out there. So that's why there are certain blood cancers that can be cured. Some blood cancers cannot. So I'm going to talk about two types of blood cancer within this session. So just need your help to pay more attention to the differences between the two. So this one is multiple myeloma. Okay, so what happens is that this is the plasma cell being mutated. Okay, so plasma cells are within what we call the white blood cells. Many people misunderstood that when white blood cells build up, they become blood cancers. No, white blood cell is a system and a part of the immune system whereby there are lots of cells. So plasma cell is just within the white blood cell type. Okay, so what happens is that when the bone marrow, that's where blood is being produced, has got too many plasmas, and it will cause a cancer, and this is called multiple myeloma. Right, so this is, you don't really have to remember the name of it, okay, so this is the PDGFRA blood cancer. That's how we call it. Even sometimes us scientists, we can't pronounce it correctly. I have to admit that. Okay, what happened is that this particular blood cancer, it's also a type of blood cancer, is caused by a mutation or an alteration in the PDGFRA gene within the chromosome 4. And if you have this kind of mutation, so then what happens is that there is an immune cell, okay, also within the white blood cell group, is being produced by a massive amount, okay? So it's called endophils. So endophils, that's part of the immune cells that is also part of the white blood cell system, and when that is being produced by too many in terms of quantity, it will also become cancer. So here's the question. Let's test how much attention are you paying, okay? What is the main difference between the two types of blood cancers I just talked about? Okay? You can write that in the comment section below, and you can even share with the others. Right, so, okay. Let's talk about cure. The thing about genetic disease, unfortunately, is that cures are very rare, and the chance of successfully curing a genetic disease is extremely low. But what I'm going to share with you is, okay, if you have a mutated gene such as the kind of blood cancer I talked about, it is possible in theory to do a gene transplant or a gene therapy whereby you cut out the mutation, you insert the normal gene back in and fuse them, and hopefully that will help you resolve the problem. But once again, it's more like a science fiction rather than a practical solution. So a mutated protein, okay, because genes produce protein, and then at this protein level, you can actually do some protein replacement, okay? Metabolic dysfunction, meaning to say that, okay, the body cannot balance the chemical inside it. You can compensate that with some diet modification and some pharmacological agents, but that is still the chances are very low, and then sometimes we don't even know what are the effects and how effective it can be. organ malfunctions, the only possible solution is an organ transplant. But more importantly, why? I mean, why shouldn't we work with prevention other than cure? So genetic counseling and get yourself genetically tested, you can detect these diseases early on. But okay, so isn't that going to contradict what I said just now? Not exactly. Because by going through a genetic test, you yourself can see if you are carrying any kinds of genetic mutation that can potentially be passed on to your next generation. Honestly speaking, if you have genetic disease yourself or in your family, you would have probably know about it by now. Even for Huntington's disease, if your family has it, probably someone in your family would have exhibited that kind of symptoms. So genetic testing is extremely important. So what I would strongly suggest you is prior to getting pregnant, check whether you and your partner has any lethal mutations being carried in the body, which doesn't affect you, but there is a chance to affect future generation. So here at Verdure Healthcare, we have something called the pre-pregnancy DNA screening. So why bother? Okay, let me revisit the basic question. In 2015, the Chicago University School of Medicine, which is a very famous university in the US, did such a research and said that humans carry 1 to 2 lethal recessive mutations on average, study estimates. If we go and have a look at the details, it says humans carry on average 1 to 2 mutations that, if inherited from both parents, can cause severe genetic disorder or death before reaching reproductive age. And the so-called reproductive age over here is around 15 years old. Yes, so, and furthermore, even Columbia University, another very famous, prestigious university in the US, had joined Chicago Uni and did this research together. So it is actually a very surprising yet quite scary research to think that, okay, even people like me and you, we look healthy, we feel healthy, but sometimes we might be carrying genetic mutations that can cause a disease. So that is why at Verdure Healthcare, our screening is being separated into 2 parts for both partners. So first part is to screen the entire chromosome. Okay, so from the first pair all the way until the 23rd pair. And here's another question to test you. What's the last chromosome do? What is the function of the last chromosome? Write that down in the comment section. Okay, so what are we looking for in here is, are there any deletions? So-called deletion would be the missing bits of the large part of the chromosome. Okay, duplication is if, let's say, there is this part being focused and being duplicated, then the entire chromosome will be elongated. So let me test you again, a lot of tests during this session. Okay, which disease does duplication belong to? I've mentioned one of them in the section just now. Okay, so you might need to rewind the video and watch it back. Inversion, okay, meaning to say that, okay, here's what's going to happen. Okay, this is a normal chromosome, and watch my index finger and the middle finger. So this particular part has been swapped to the other chromosome and flipped. Okay, so that's inversion. Substitution, okay. Substitution meaning to say that 2 different chromosomes. For example, chromosome 4 and chromosome 20. So this is called the inter-chromosome substitution. It's swapped around. So as you can see, a bit of blue here, a bit of green, and then this entire chromosome actually gets shortened. Okay? And then translocation. Okay? So the entire chromosome has been translocated to other locations. So substitution, it has gone somewhere else. There is no exchange over here. But translocation, there is an exchange. Okay? So number 20 chromosome gives number 4 chromosome this particular part, and chromosome number 4 gave chromosome 20 this particular part. Okay. So I know this is a bit complicated, so that's why I try to explain it in a more careful sense. But anyway, all you need to remember is that any testing with the chromosome, what we are looking for is actually the 5 major categories of chromosomal abnormality. And if there is, you as a person will not get affected because there is actually no gain or loss of information unless it's a deletion or duplication. Otherwise, an inversion, substitution, translocation, nothing is going to happen to you. You're going to live very healthily, and you're going to live a long life, okay, hopefully. But deletion and duplication, there will be something wrong because there is less genetic information and there's more genetic information, okay? Right, if we were to move on to part 2, okay, so at Verdure Healthcare, our pre-pregnancy DNA screening will screen for 155 Asia's most common genetic diseases. Okay, and even within these individual genetic diseases, there are different versions. And altogether, there are 9,000 versions within the 155 Asia's most common genetic disease. So I'm not going to go into detail about this particular picture. Basically, it is the method on how to extract the DNA, line it up compared to the normal reference DNA, only then we'll be able to see if there's any mutation within your DNA. So this is more of a single gene level, okay? Right, okay, so this is a sample report. So one of the sample report, and this is a live report, whereby it is a female partner where she's carrying 3 genetic diseases: beta thalassemia, Smith-Lemli-Opitz, and Wilson's disease. So with this, she is actually fine. She has no problem at all. But once again, this actually fits with what Chicago University said, whereby every human will carry at least 1 to 2 lethal mutations. And this is exactly what happened. But in terms of her husband, okay, the male partner, he was carrying alpha thalassemia, okay, instead of beta thalassemia. So in this particular case, it's okay for them to get pregnant naturally because the disease don't match. If, let's say, her husband is carrying beta thalassemia, then there will be a problem because her beta thalassemia carrying gene and her husband's beta thalassemia carrying gene, when they get together, there is a 25% chance of the child getting beta thalassemia. Okay? So, as you can see, let me illustrate one more time. Mom and dad carrying the same diseases. There's a 25% chance for the child to get the disease and become affected. There is a 50% chance of the child who will be getting the gene, but they are just like mom and dad, they are the carriers. They are not going to be affected by the disease. And then there's only 1/4 chance whereby the child can escape the entire disease devil claw. Right, but all of these genetic testing, they had to be reviewed by a professional. Why? Because here's the question. If, let's say, using the case just now, if the husband and the wife are really carrying beta thalassemia, what should they do if they want a child? Okay, have a guess. I will give you around a few seconds to have a guess. All right, but anyway, let's move on while you're thinking about it. So, what constitutes a professional doing genetic tests? Okay, you must have a medical base. Like myself, I'm qualified as a surgery instructor because I have a postgraduate certificate in surgery from the Royal College of Surgeons of England. But that is not enough, okay? Even though I'm qualified as a surgical instructor, I have to get further study in genetics in order to explain about genetics to you. Furthermore, because the rules are getting more and more strict, if you want to offer people genetic tests, you have to go through extensive training specifically for genetic testing and the relevant sequencing technology. So if you can recall just now the very complicated picture on how to extract the DNA, that is the sequencing technology. So currently we're using something called the next generation sequencing technology, or the NGS technology. With that, you have to organize data because, as you might be able to recall, genes are separated into 4 codes, G, C, A, and T. Okay, there are 4 codes, but even then, a lot of things can happen. When you line up all these codes together, you have to pack them into something meaningful. With that, you have to get the genomic data science qualification in order to sort out the data into neat packages. Right, okay, so some of you might have heard of commercial genetic tests. With that, for example, Circle DNA, 23andMe. So these are very good genetic tests to test your wellness. Okay, so there are more to wellness genetic tests. What kind of food should you eat? What kind of exercise should you do? And even there are some commercial genetic tests on your personality, on your talents, and what career direction should you go with. Okay, I wouldn't make any comments as to the accuracy of these tests, okay? But anyway, if you really want to know about yourself, if you really want to live an even healthier life, please go ahead to get one of those tests for yourself, right? It's fun. But for clinical genetic testing, there is a huge difference because this commercial genetic test, they use your saliva to do the testing. But for us, we have to take your blood, and we insist on doing so because it is clinical. What does it mean by clinical? Whereby there are medical decisions that has to be made. For example, okay, just now that case, beta thalassemia. If the male partner and the female partner are carrying that disease, not being affected, but still there's a huge chance of the child being affected, we have to send them off to an IVF center to do something called the embryo genetic selection. Only when we select the embryo without beta thalassemia, we can then put this embryo back into the womb in order for a safe pregnancy journey. Okay, so once you have gone through all these testing, the second step is to enhance the quality of the sperms and egg cells. And these are extremely important because genetic diseases such as a Down syndrome can be caused spontaneously. Okay, that is due to the quality of sperms and eggs not so good. So our products, our fertility supplements has won the Baby Talk Mama Papa Reader's Choice Award 2021. And I would like to use this opportunity to thank you so much for our consumers to vote us to be the Reader's Choice. We really appreciate it. And so under this category, we have the VHC Formula Female 1 and Female 2. And this is the IVF natural food supplement. So if you're planning to go for an IVF cycle, you need to specifically prepare for it. So the Female 1, VHC Formula Female 1, it enhances your ovulation function and the egg quality. Female 2, it enhances the quality of the internal environment in the uterine. And for male, we have the VHC Formula Mile, and so this is excellent fertility food supplement for male, okay, for men, sorry, okay. So whether you're planning for natural pregnancy or even IVF, for us guys, it doesn't really make a difference, but anyway, that's why this formula is to enhance the sperm swimming capability, the quantity, the shape, and also, other parameters that are important. And yeah, by the way, we do have confinement products. So what's confinement? Whereby after you deliver the baby, you need to recover from it, okay? So in that case, our VHC Formula Confinement 1 and Confinement 2 will do exactly just that to help you recover and also to prepare you for the next pregnancy. Okay, and furthermore, Verdure Healthcare has also won the Superbrands 2021 Malaysia's Choice just because of our practice and branding, and also our the trust that consumers are giving us. In fact, Superbrand is not something that you can nominate yourself with. It has to be nominated by a panel of judges, 3,000 judges in the panel. So that's something really proud that we have achieved, and thank you so much. If without your support, we will never be able to get to this milestone. Okay, so the third and the very last step is the conception, is to get pregnant. Okay, if you don't have any mutations at all, if you're not carrying any lethal mutations, then you should get pregnant naturally. Okay. So in that case, when you get pregnant naturally, we have the home artificial insemination IUI that is just at 1/50th price of IVF and 1/10th of the regular hospital-going IUI, traditional IUI. Okay, so you do this at home by following 3 very simple steps. Number 1 is to track your menstrual cycle. Okay, and why do we need to do that? Okay, because during ovulation, there will be a slight bump of the temperature because the body will release a hormone called the luteinizing hormone, or the LH. So when the LH has been released, that's the time of ovulation. And as you can see, the body temperature will bump up. Of course, this is a perfect example, but anyway, as you can see, the first half of the cycle, the body temperature remains quite low, and then when ovulation started, then actually the body temperature increased slightly. So what we want to do is to catch this particular window, the bump up window, and during the time, because you probably track 1 to 2 months, and when you get the timing, you will do a confirmation on your ovulation by doing this test. It's very simple. It's called the LH ovulation test. Once you get a positive, meaning that you are ovulating, you should use this IUI Kit in order to, on the same day, collect the male partner's sperm cells, and then follow some very simple assembly steps to assemble the IUI Kit and inject the sperm directly into the uterus. So this is really a shortcut for the sperm cells. Okay, and currently, by the way, we started this particular home artificial insemination IUI program back in August, and the first batch of customers came in September, and by October, quite a number of them have been pregnant. So I'm so glad that this is able to help quite a number of people. So who's suitable? Okay, basically, if you feel stressed, okay, to go with the most natural way during the ovulation time, then you can use this. But basically, if let's say the male has got low sperm count, poor motility, and abnormal shape, this is particularly suitable. And for female with high amounts of antibodies, recurrent infections, or pain during the intercourse, this is also very suitable. Alright, but what happens if you really need IVF? Okay, so normal IVF doesn't really help because it doesn't include the embryo selection. So with the embryo implantation genetic diagnosis or pre-implantation genetic screening. Okay, so PGD, how is that done? Okay, when you go and see a doctor, you accept the treatment, you get the injections or medications back home, inject yourself. During the time, you go back to the hospital, and the doctors would do something called the oocyte pickup, meaning to say they will extract your eggs. So on the day, the male partner will also produce a sperm sample, and then they will fuse that up with the egg, and then put that into an incubator or an artificial womb for around 5 to 6 days. But afterwards, they would run through a genetic test for the embryo. So if they see there's any genetic mutations in the embryo, they would have to discard it. Okay, so that is the key. If let's say you are carrying any genetic diseases, we have to catch it at this particular stage to see if the embryo has received such a gene from you. Okay, So that's it. As you can see here, that's how this process is being done. There will be a needle that sticks into the embryo, and then to take 1 or 2 cells and to run through the genetic test. But some people ask me, Adam, why can't we just go straight away and then do IVF, do PGS, PGD? Of course, number one is money problem, because the cost itself is very high, around 35 to 55,000 just on this particular process itself, the PGS, PGD, and that doesn't even include the normal cost of the IVF. So it's very easy. You can just go and search cost of PGS, PGD in Malaysia, put that in Google, and you should get the answer. Right, so regardless of your particular situation, we will here at Verdure Healthcare tailor-make a fertility solution just for you, because no 2 couples share the same solution. That is why we work with many partners. For example, genomics lab and DNA lab. These 2 labs are the genetic testing labs. BP Path Lab, I'm sure majority of you have heard of it. But in terms of IVF centers, we work with Alpha Fertility, TMC, Sunway, Thompson. So these are our trusted partners, and that we can follow up your case. Sonovision, an ultrasound center, and Gribbles, just like Path Lab, is a blood testing center. Right, coming towards the last bit of this presentation, I just want you to remember one thing. Your genes determine your baby's lifetime health. Prevention is definitely better than cure, okay? Because currently for genetic diseases, there is just so little cure, all right? So I hope you like my presentation today, and if you do, please kindly like my video, kindly share it with your friends and family, subscribe to our channel so that when we have new videos, new presentation or new lives, we can share it with you immediately. And come and give us a call. We would love to hear from you. So if you are planning for a pregnancy, or if you have difficulties getting pregnant, we would love to hear from you. There's no shame about it, really, because modern day living, we are living in a polluted environment, and there's really no way of knowing what the environment can do to damage our health. Okay, so let us help you resolve that particular problem. And until then, I will see you next time to introduce you to chromosome 5. Thank you very much.